everyone. We are joined today by Dr. Ray, who is going to talk to us about his journey to the UK and answer a few questions about how he's found the NHS so far, how he's found his job and all the bits and pieces. So, hi, Dr. Ray. Hi. Nice to speak to you. Really nice to speak to you. Could you maybe kick us off just by telling us about your journey to the UK? So a bit about your background, your grade, your specialism, the kind of role that you were looking for, and the job that you found in the end.
Right. So I came from India, and I did completed my undergrad in the year 2011, followed by a 1 year of internship, which is equivalent to the foundation year 1 in the UK. That was back in 2012. So I am currently here under the Medical Training Initiative, the MTI Scheme, for which I had actually attended an interview which was conducted by the Royal College of Physicians back in 2018 in India. And because that's a two-step process, once I cleared the interview, I was matched with my current trust, that is Epsom and St Helier's University Hospitals NHS Trust. And once I agreed for an interview with this particular trust, they had done a Skype interview when I was back in India, and then they had actually selected me, and then the procedures all began in terms of me coming here and joining in this trust.
Excellent. SHO. Great. And how did you find the relocation process, first of all? Did you find it easy to get your certificate of sponsorship and the tier 2 application and then the actual moving itself? Was it straightforward for you, or did you find any pitfalls and any difficulties?
Not exactly. So just to sort of rectify a bit, I am under the tier 5 visa and not the tier 2 visa.
Of course. Yeah.
So my certificate of sponsorship and everything was extremely smooth, thanks to the Royal College of Physicians, my current trust, and most importantly, the Academy of Royal Medical Colleges, who actually issue the tier 5 visa to us. Tier 5 certificate of sponsorship, and then the visa. So because it was a straightforward COS from one of the A-rated sponsors in the UK, my application process was extremely smooth. I got the visa, and my relocation was also quite smooth. I got my hospital accommodation almost immediately after coming here.
Brilliant.
So I had a good settling down time here.
And did you move with family, or did you come on your own?
I came on my own.
Okay, cool. And how have you settled into the UK? How's it been to settle in culturally, and how have you found things like the weather and everything like that?
I was just coming into this.
It's getting cold.
A country like India, where the minimum temperature is, at my place, is never below 11 degrees. Yeah. So the day when I was coming over, the temperature over there was somewhere around 22, because that's the winter time in India. And I came via Dubai, and Dubai was more warm. And I remember the time when I actually landed in Heathrow Airport on a cold Sunday evening at around 7:30. When I came out of the airport after immigration, I was greeted by the cold wave when the temperature outside was somewhere around 5 or 6. And that was a huge shock when I literally froze outside and requested the cab driver, please take me in the cab as soon as possible. So, the next few days, yes, I had my GMC registration coming up, collection of my BRP, coming into my trust for an occupational health check. I did struggle in the cold as usual, but over the next few months, and now I've been here for almost 21 months or something, I've actually got used to it. I'm quite enjoying the weather.
Yeah, it definitely gets better as you go on. How was the actual induction? Because lots of doctors that we place and lots of doctors that we talk to find that first 2 or 3 weeks in the UK quite daunting, and sometimes that's the time they feel the most homesick. How was that for you?
I would say I'm quite fortunate enough to be matched and being offered an employment in this trust, because which is I believe one of the most IMG friendly trusts in the UK. I got an induction within the first week itself. I don't know whether that, and I suppose that was actually planned out in a way so that most of the trainees, when they rotate in, most of the MTI trainees, when they come in, and some of the other non-training doctors from outside the UK were coming in. So we had a whole day of induction where we were actually sort of demonstrated regarding the use of the electronic system which the trust use. And that was extremely smooth. Now, obviously, considering the fact that the pattern of working in India and in the UK is quite different. It definitely took a little bit of time to settle down, but again, I would say that thanks a lot to my senior colleagues, my consultants, my co-registrars, co-colleague registrars, that it was extremely supportive, and I found it quite easy to settle down.
Good. What was the biggest difficulty you faced in joining the NHS from your healthcare system in India?
To be honest, I think the biggest difficulty I would say is the financial aspect, because there's a huge currency difference between the Indian currency and the UK currency. And because with the international doctors who are coming in, they need to pay both the visa charges as well as the immigration health charges. It can sometimes be a huge burden on them to initially come in, and then in the first month when you are without your salary but you have to survive in the UK, that can sometimes become a bit challenging. But obviously, if someone plans it out nicely and makes quite a bit of savings in the beginning, then it's easy, and it's actually possible. I won't say easy, but it's possible to sort of cruise through the first month. And when you start earning here from your second month onwards, then you can plan out and budget yourselves according to the expenditures you have.
Yeah, definitely. And how have you found the area that you're in? So what's Epsom like, and do you like it as a place to live?
So to be honest, I'm based at the St. Helier site, which is not in Epsom. That is in a place in an area called Sutton. That's in Surrey. So it still has it has got a London feel to it, and it's quite easy to stay in because this area has a mixture of people from all over the world, and we have quite significant Asian population here, some African population here, and definitely there are British people around. So it's a good mix. We have got quite good shops around, marketplaces around in Tooting or in Sutton, the high street markets. So in a nutshell, it's not very difficult. I didn't find it difficult to sort of settle down in that place. And because I'm staying in a hospital accommodation, which is in the same building that I work in, so there is no need for me to travel like long distances. So that's sort of been smooth for me.
Yeah. And have you had much chance to visit the rest of the UK? Have you been to visit many other cities, and any that you particularly like?
Yeah, I'm a tourist by heart actually. So I take all opportunities to visit UK. Maybe it's because of like a leisure visit or because of doing trainings and stuff or giving exams. So I don't leave any opportunities to tour around. And also during my 0 days, I have had chances to go around other parts of England. I've also been to Scotland, and I plan to visit the other scenic places like Lake District and Cotswold quite soon.
Good, excellent. And moving on to talk about your speciality. So you're a medicine doctor at the moment, that's right?
I am.
So are you in acute medicine, or are you in one of the subspecialisms?
So I'm currently working in the gastroenterology department, which but our ward is an outliers. It's not the exact gastroenterology, but we have mixture of all specialty patients, including the care of the elderly, respiratory, but some gastro definitely. I did start with acute medicine during my first rotations, and then I rotated out into renal and hematology, which I believe is quite good rotations to do in order to sort of improve your holistic approach towards medicine patients. But at the moment, yes, I'm in general medicine and in gastroenterology subspecialty, and this is quite rewarding and encouraging in terms of gaining knowledge and experience.
Great. So do you plan to apply for specialist training and carry on the NHS through the ST3 route?
Yes, I do. I'm waiting for my paces to be done, but unfortunately, the Royal College has got some rules that the doctors who are coming under the MTI scheme needs to basically go back to their country. So maybe not anytime soon, but because I don't want to violate any rules. But if they make it sort of, they relax the rules a little bit that we can come over and apply for training posts, then I think I would definitely look forward to it, because I believe the training in the NHS is considered one of the best in the world. And if they make it more relaxing in order for us to finish our specialty training, then we have much more to offer back in our home country rather than going back now and offering our knowledge.
Absolutely. Well, best of luck with Pacers, and hopefully you get onto that training role.
Thank you so much.
One of the big questions that lots of our doctors ask us is, what does an average day look like in the NHS? So, and I know that might be very variable every single day, but maybe if you could give us a feel for what that looks like in your case.
So, I mean, it again, I would say winters are especially busy. And the good thing about it is that you get to learn a lot if you are quite busy. And yes, the days can be extremely busy. Starting from 9 o'clock in the morning until 5 o'clock, the time literally flies. So you sometimes have to be on your feet all the time. But the good thing being that you are always supported by your colleagues. Even if you are struggling and they have finished up their work, they're very keen to come and help you out. And it same goes vice versa. So overall, teamwork is really good here. And the best thing that I would say is that there is no hierarchical system. Everyone comes across quite approachable. In stark contrast to place where I come, where there's a strict hierarchical system and people think twice about arguing or putting their views across the senior colleagues, especially consultants. The other thing what I would say is that the culture of shouting at and possibly verbally abusing people is absolutely not here, which I think is a great thing in that can be sort of presented to people in order to express themselves, in order to become more confident. And overall, one doctor becomes confident, everyone becomes confident, the teams becomes more efficient, good patient care, and ultimately it's about the patients.
Excellent. Great stuff. All right. Last question from me, and thank you so much for your time this afternoon. If you could give one piece of advice to all of the IMGs that will hopefully watch this video and to all of our followers that Gabby talks to every day, what would that piece of advice be?
My advice to the fellow IMGs who are looking forward to coming to the UK, I would say come to the UK with an open mind. It's a great country. People are really welcoming. It's a multicultural place, especially in London. And try mixing up with people, try to be extremely friendly with them. Look at patients' interest, but also, I would say, work hard, party harder here. That's the exact way you are able to sort of put your optimum effort without getting bored and without life getting monotonous. And every patient is a new case to understand, new thing to learn. So make full use of it. And yeah, it's a great country. Welcome to UK. You will
Amazing.
find your time.
Thank you so much, Dr. Ray. Really, really appreciate your time this afternoon. And to everyone that's watching, thank you so much for watching. Tune in. As always, Gabby will put the contact details up. And if you've got any questions for us or perhaps Dr. Ray, then feel free to mail them to Gabby and we'll get back to you as soon as possible. Thanks so much for watching. Take care. Thank you.
Thank you.